Hello everyone, now let us discuss about CPT coding guidelines for surgery, musculoskeletal system, part 3b. Here we will be focusing on spine or vertebral column. And in the current session, we will discuss the CPT codes of incision, excision, osteotomy, fracture and dislocation, manipulation, percutaneous vertebroplasty and vertebral augmentation. Now, before going into CPT sessions, let us discuss about 62 modifier. In simple words, 62 modifier means whenever two surgeons work together as primary surgeons, performing distinct parts of a procedure. Each surgeon should report his or her distinct operative work by adding 62 modifier to the procedure code and any associated add-on codes for that procedure as long as both surgeons continue to work as primary surgeons. So whenever two surgeons work as primary surgeons for a particular procedure, then you can use 62 modifier. In case of spine procedures, certain segments they allow 62 modifier and certain segments they do not allow 62 modifier. We will discuss that point in detail whenever we talk about that particular topic. For example, you can see in orthodesis that we will be discussing in the next session when we must use 62 and when we must not use 62. As of now, 62 means whenever two surgeons work together as primary surgeons performing distinct parts of a procedure. Each surgeon should report his or her distinct operative work by adding 62. And each surgeon should report the co-surgery once using the same procedure code. If additional procedures, including add-on procedures, are performed during the same surgical session, separate codes may also be reported with modifier 62 added. One more important point is if the co-surgeon acts as an assistant in the performance of additional procedures other than those reported with modifier 62 during the same session. For example, two surgeons are performing the operation and in one procedure, multiple procedures are performed. One procedure, two surgeons are acting as primary procedures, and if in another procedure, if the co-surgeon acts as an assistant in the performance of additional procedure other than those reported with modifier 62 during the same surgical session, those services may be reported using separate procedure code using modifier 80 or 82 as appropriate. Now coming to the guidelines of excision. For the following codes, when two surgeons work together as primary surgeons performing distinct part of partial vertebral body excision, each surgeon should report his or her distinct operative work by appending 62 modifier to the procedure. In this situation, modifier 62 may be appended to procedure codes 2212210, 22102, 22102, 22114 and as appropriate to associated additional vertebral segment codes 22103 to 22116 as long as both surgeons continue to work together as primary surgeons. Now coming to the CPTs for incision and excision. The first one is 22010, which is nothing but incision and excision of open of deep abscess, subfacial, posterior spine, cervical, thoracic or cervicothoracic. Whenever incision and drainage, open incision and drainage of deep abscess of posterior spine is done, for example, cervical, thoracic or cervicothoracic, then you must report it with 22010. The next CPT is 22015 for lumbar sacral or lumbosacral. For incision and drainage open of deep abscess of lumbar sacral or lumbosacral, you need to provide with 22015. The next code is 22100, partial excision of posterior vertebral component. Example, spinous process, lamina or facet. For intrinsic bony lesion, single vertebral segment, cervical. Partial excision of posterior vertebral component. Excision of spinous process or lamina or facet. For intrinsic bony lesion, single vertebral segment. When it is cervical, you need to report it with 22100. When it is thoracic, you need to report it with 22101. And when it is lumbar, you need to report it with 22102. Here you can see the CPTs for partial excision of posterior vertebral spinal process, lamina or facet. So whenever partial excision of spinous process, lamina or facet is done for intrinsic bony lesion, single vertebral segment. For cervical, you need to report 22100, 22100. For thoracic, you need to report 22101. And for lumbar, you need to report 22102. And for each additional segment, for each additional cervical or thoracic or lumbar vertebral segment, you need to use this add-on code plus 22103. Now coming to next CPTs, 22110. Here it deals with partial excision of vertebral body. For intrinsic bony lesion without decompression of spinal cord or nerve root, single vertebral segment. For cervical, you need to report with 22110, 22110. For thoracic, you need to report 22112. For lumbar, you need to report 22114. And for each additional segment, you need to report this add-on code plus 22116. Here you can see the partial excision of vertebral body. Previously, it was spinous process, lamina or facet. And here this is the partial excision of vertebral body for intrinsic bony lesion without decompression of spinal cord or nerve root. Single vertebral segment. For cervical, you need to report with 22110, and for thoracic, you need to report with 22112, and for lumbar, you need to report with 22114. And for each additional segment, whether it can be cervical or thoracic or lumbar, you need to use this add-on code plus 22116. Now coming to osteotomy. Osteotomy is nothing but cutting and reshaping of bone. For the following codes, whenever two surgeons work together as primary surgeons performing distinct parts of an anterior part osteotomy, each surgeon would be reported with 62 modifier. Each surgeon should report his or her distinct operative work by appending modifier 62 to the procedure code. Can be given for 22210 to 22214 and for 22220 to 22224 in this range as appropriate to associated additional segment add-on codes also 22216 and 22226 as long as both surgeons work together as primary surgeons. Now, spinous osteotomy procedures are reported when a portion of the vertebral segment is cut and removed in preparation for realigning the spine as a part of spinal deformity correction. That is, spinal osteotomy procedures, they are often combined or performed together with orthosis, orthodontics or deformity correction or spinal instrumentation, etc. So whenever spinal osteotomy procedures are reported with a portion of the vertebral segment is cut and removed in preparation for realigning the spine as a part of spinal deformity correction, you need to use this code separately. And for excision of intrinsic lesion of vertebrae without deformity correction, you need to report the previous codes which are in the series 22100 to 22116. And for decompression of spinal cord or nerve roots, you need to see the code range 63001 to 63308. In the code description of osteotomy codes, you can see three columns. So what are the three columns? The first one is anterior, which represent anterior 2/3 of the vertebral body, and the next column is middle, which represents the posterior third of the vertebral body and the pedicel, and the next is posterior column, which represents articular facets, lamina and spinous process. So these are the three columns. Now coming to the CPTs of osteotomy. The first one is 22206. Osteotomy of spine, posterior or posterior lateral approach. 3 columns, 1 vertebral segment. Example, pedicel, vertebral body subtraction, thoracic region. And next code is 22207. This is reported for lumbar region. And the next is an add-on code plus 22208 for each additional segment. For each additional vertebral segment, you need to use this code. The next is 22210. Osteotomy of spine, posterior or posterior lateral approach, one vertebral segment, cervical. Here in this code description, you don't find columns. Osteotomy of spine, posterior or posterior lateral approach, one vertebral segment, cervical. And for thoracic region, you need to report 22212, and for lumbar, you need to report 22214. And add-on code plus 22216 for each additional vertebral segment. The code 22216 should be used in conjunction with 22210 or 22212 or 22214. Next code is 22220. Osteotomy of spine including discectomy, anterior approach, single vertebral segment. Osteotomy of spine including discectomy. Whenever osteotomy is performed including discectomy, anterior approach, you need to report 22220 for cervical and 22222 for thoracic, 22224 for lumbar. Next add-on code plus 22226 for each additional vertebral segment. Now coming to codes of fracture or dislocation or dislocation. To report, so fracture can be treated by orthodesis or instrumentation or using bone codes. And to report orthodesis, you need to see the codes 22590 to 22632. Report in addition to the code for definitive procedure with 51 modifier. To indicate multiple procedures, whenever fracture treatment is done along with orthodesis, you can report the additional codes with 51 modifier. To report instrumentation procedures, you need to refer 22840 to 22855 and again 22859. Do not append 62 modifier for spinal instrumentation codes which are in the range 22840 to 22848. And for 22850, 22852, 853, 854 and 859. All these codes, whenever they are performed, spinal instrumentation codes, you should not append 62 modifier. And to report bone grafts, you need to refer 20930 to 20938. Here also you need not append, you should not append 62 modifier for bone graft codes. So in the fracture treatment, fracture or dislocation treatment, whenever spinal instrumentation or bone grafts procedures are done, in these cases you should not append 62 modifier. And for following codes, whenever two surgeons work together as primary surgeons performing distinct part of open fracture and or dislocation, when they are performing only fracture treatment, open fracture or dislocation procedure, each surgeon should report her distinctive work by appending 62 modifier to the procedure code. This is a little tricky. We will discuss in detail during spinal instrumentation and reporting of bone grafts. But as of now, along with fracture codes, you should not append 62 modifier for bone grafts CPTs or for spinal instrumentation CPTs. In general, apart from bone grafts or spinal instrumentation CPTs, whenever fracture or dislocation codes are performed or they are used, and whenever two surgeons work together for the treatment of fracture or dislocation as primary surgeons performing distinct part of open fracture or dislocation procedure, each surgeon should report his or her distinct operative work by appending 62 modifier. And in this situation, modifier 62 may be appended to the procedure codes 22318 to 22327 in this range. And as appropriate, the associated additional fracture vertebrae or dislocated segment add-on codes. They can also report 62 modifier 22328 as long as both surgeons continue to work together as primary surgeons. In simple words, if two surgeons are involved in fracture or dislocation treatment and if they both are acting as primary surgeons, then you can give 62 modifier. But you should not report 62 modifier with the spinal instrumentation codes and bone graft codes. Now coming to the codes for fracture and or dislocation and manipulation. First code is 22310. Closed treatment of vertebral body fracture without manipulation requiring and including casting or bracing. The next code is 22315. 22315. This involves closed treatment of vertebral fracture and or dislocation requiring casting or bracing with and including casting and bracing by manipulation or traction. Here manipulation is involved in 315. Manipulation is not involved in 310. 22310 does not include manipulation, whereas 22315 includes manipulation. The next is 22318. Open treatment and or reduction of odontoid fracture and or dislocation, including odontoidium anterior approach, including placement of internal fixation without grafting. Whereas 22319, it involves grafting, with grafting. Next is 22325. Open treatment and or reduction of vertebral fracture and or dislocation posterior approach. One fractured vertebrae or dislocated segment lumbar. Posterior approach, one fractured vertebrae or dislocated segment lumbar. For lumbar, open treatment and reduction of vertebral fracture of lumbar region. Fracture or dislocation of lumbar region, you need to report 22325. And for cervical region, you need to report 22326. And for thoracic, you need to report 22327. And for each additional segment, each additional fractured vertebrae or dislocated segment, you need to report this add-on code 22328. The next code is 22505. This is manipulation code. Manipulation of spine requiring anesthesia, any region. So whenever manipulation of spine is done, any region requiring anesthesia, and you need to report it with 22505. Now coming to codes for percutaneous vertebroplasty and vertebral augmentation. Vertebral augmentation or simply augmentation of vertebral fracture is achieved by percutaneous injection of polymethyl methacrylate under fluoroscopic guidance. Now coming to the guidelines of percutaneous vertebroplasty and vertebral augmentation. The codes 22510, 511, 22512, 22513, 514 and 515 describe procedures for percutaneous vertebral augmentation. Vertebral augmentation includes vertebroplasty and kyphoplasty, as we have discussed in the yesterday's session. The definition of vertebral augmentation involves vertebroplasty and kyphoplasty. So vertebral augmentation that includes vertebroplasty of cervical, thoracic, lumbar and sacral spine. These codes, all these 6 codes, they involve or include vertebroplasty of cervical, thoracic, lumbar and sacral spines and vertebral augmentation of thoracic and lumbar spines. And for the purpose of reporting these codes, vertebroplasty is the process of injecting a material that is nothing but cement into vertebral body to reinforce the structure of the body using image guidance. And vertebral augmentation is the process of cavity creation followed by injection of the material under image guidance. And for reporting 0200T and 0201T, sacral augmentation, which is nothing but sacroplasty, refers to creation of cavity within the sacral vertebral body followed by injection of the material to fill the cavity. Sacral augmentation is given by the codes 0200T and 0201T. The procedure codes are inclusive. All these vertebroplasty and vertebral augmentation codes are inclusive of bone biopsy. You need not separately report bone biopsy when performed, and imaging guidance are also included. Use one primary procedure code and add-on code for additional levels. This is also important. And when treating the sacrum and sacral procedures are reported once per encounter. Whenever treating sacrum, sacral procedures are reported once per encounter. Now coming to the codes, the first code is 22510, which is nothing but percutaneous vertebroplasty, bone biopsy included when performed, one vertebral body. Percutaneous vertebroplasty, one vertebral body, unilateral or bilateral injection inclusive of all imaging guidance, cervicothoracic region. Cervicothoracic region, whenever vertebroplasty, percutaneous vertebroplasty is performed in cervicothoracic region, you need to report 22510. And whenever it is performed in lumbosacral region, you need to report 22511. And additionally plus 22512 for each additional cervicothoracic or lumbosacral vertebral body. For each additional vertebral body, you need to report this add-on code plus 22512. The next code is 22513. Percutaneous vertebral augmentation including cavity creation, fracture reduction and bone biopsy when performed using mechanical devices, example kyphoplasty. As we have discussed earlier yesterday, vertebral augmentation is nothing but it includes vertebroplasty and kyphoplasty. Vertebral body, unilateral or bilateral cannulation inclusive of all imaging guidance. Thoracic. For thoracic region, you need to report 22513. For percutaneous vertebral augmentation of thoracic region, you need to report 22513. And for percutaneous vertebral augmentation of lumbar region, you need to report 22514. And for each additional thoracic or lumbar vertebrae, you need to report this add-on code plus 22515. The next code is 22526. Percutaneous intradiscal electrothermal annuloplasty, unilateral or bilateral including fluoroscopic guidance, single level. And for each additional level, one or more additional levels, you need to report this add-on code plus 22527. Now let us discuss an example. Quote the following. Kyphoplasty at L1 and L2 with bone biopsy at L1 and L2. So kyphoplasty is performed at L1 and L2. Kyphoplasty is included in vertebral augmentation. So the appropriate code is 22514. Percutaneous vertebral augmentation including cavity creation, fracture reduction and bone biopsy. Here bone biopsy is also performed at L1 and L2. And bone biopsy is included in the code description itself. So percutaneous vertebral augmentation including cavity creation using mechanical device, example kyphoplasty, one vertebral body, unilateral or bilateral cannulation inclusive of all imaging guidance. Lumbar 22514, it deals with lumbar region. The next is 22515. This is an add-on code because here two vertebrae L1 and L2. So for L2, additional add-on code should be reported 22515. Each additional thoracic or lumbar vertebrae.